Here we have a cross-section of the spinal cord up in the cervical region. How do you know this is the cervical region? You know this already, don't you? Look at that vertebra. You can see the body, you can see the bifid process, the spinous process, and notice the big foramina there in the transverse processes, the transverse foramina. That's where, remember, where arteries are carrying blood up to the brain. So we have a cross-section here of spinal cord. Let's this is showing the meninges, and let's take a look here. So notice on the diagram, see where it says dura mater. All right, that's that grayish band. Notice that above the dura mater there's a space. It's full of adipose tissue, but that space, because it's above the dura mater, what do we call that space? We call it the epidural space. Then we have the dura mater, and then notice underneath the dura mater there's another little space there, much smaller space. Since it's underneath the dura mater, it's called the subdural space. Then next comes the arachnoid mater, and underneath the arachnoid mater is the subarachnoid space. All the names tell you exactly where they are. And here you can see for the first time perhaps why it's called the subarachnoid space. Look, it's full of spider webs. See the spider webs? Those are called arachnoid trabeculae. And remember, that space is full of cerebrospinal fluid. And then right down on the spinal cord itself, you can see the pia mater, right? The gentle mother right down on the cord itself. So there you see the meninges and the spaces, and notice you can also see the roots, see the ventral and dorsal roots, and you can see how they come together to form a spinal nerve. And then you can see here the dorsal root ganglion. Remember, that's where the cell bodies of the sensory neurons are. And then when you look at the cross section of the spinal cord, you can see the dorsal horns and the ventral horns. Notice the ventral horns are big and wide because they have the cell bodies of the motor neurons, whereas the dorsal root ganglion has the cell bodies of the sensory neurons. Let's talk about some rami. Ramus we saw before. Ramus means branch in Latin. Rami is plural of ramus. Remember on the mandible we had the ramus of the mandible, the branch that moved up from the body. So what happens here is that the spinal cord, the spinal nerve rather, the spinal nerve branches right after it leaves the spinal cord. One branch goes around to the back, one branch goes around to the front. The branch that goes around to the back is called the dorsal ramus, and the one that comes around to the front is the ventral ramus. All right. So the dorsal ramus goes to the dorsal side of the body. You can see in the diagram there, see posterior or dorsal ramus, and then see anterior or ventral ramus. Look right now, notice the difference in size and thickness. Look at how the dorsal ramus is skinny and the anterior ventral ramus is much thicker. Why is that? Think about that for a moment. Where's the dorsal ramus going? It's going behind the spinal cord. How many things in your body do you have that are behind the spinal cord? Other than some big back muscles, you don't have much back there. So you don't need a whole lot of axons going there. On the other hand, what have you got in front of your spinal cord? Holy smoke, you know, you've got all your internal organs and all the muscles on the front of your body and so on. So the dorsal ramus is much thicker than the ventral ramus. I just said it backwards. The ventral ramus is much thicker than the dorsal ramus because there's hardly anything behind your spinal cord. And then notice there's another one here. You can see it on the right side of the diagram. It says rami communicantes. These are the communicating branches. Singular, by the way, is ramus communicans, plural rami communicantes. And what are they for? They're autonomic nerve fibers. So the autonomic nervous system we're going to be talking a lot about in the fourth section of the class. Autonomic nervous system controls all of the sort of unconscious things in your body. Heart rate, breathing, digestion, all release of hormones by glands and things. Stuff that you don't have direct conscious control over. And what happens is different parts of the spinal cord need to talk to one another, and the rami communicantes are what do that. We'll see that when we get to the fourth part of the class. Rami communicantes are communicating branches that connect different segments of the spinal cord. So, three kinds of rami here: the dorsal ramus and the ventral ramus, which are parts of the spinal nerve, and then the rami communicantes, which basically go up and down the spinal cord to connect different segments of the spinal cord. Here another great diagram showing the kind of stuff we've been talking about. I'm not going to go through this with you right now, but you should spend some time going over on yourself, by yourself, I should say. There you can see again the dorsal ramus thin, ventral ramus thick, and there you see the rami communicantes. Notice where it says sympathetic chain ganglion. There are a whole bunch of those that go up and down the spinal cord, and each one has rami communicantes coming out of it. And that's how communication can go up and down the spinal cord through the rami communicantes. Goes up and down the sympathetic chain ganglion. And here again you can see the rami. There's the dorsal ramus going just to muscles on your back, whereas the ventral ramus has got to go around to the front of the body and to all the things that are on the front side of your body. So, when nerves emerge from the spinal cord, they tend to emerge in bunches. And the word here is plexus. In Greek, the word plexus means a braid, like where you braid your hair. And it gets used a lot in anatomy. Basically, anytime there's a tangle, you can think of plexus like a braid or a tangle. So, a lot of times we have blood vessels that form plexuses. It'll be a whole bunch of blood vessels all kind of wrapped around each other together to form a bundle. Same thing with nerves here. So the ventral rami form these bundles called plexuses as they leave the spinal cord. And there are four main plexuses. The cervical plexus emerges up in the cervical region. It's formed by nerves C1 through C4. Remember, there were 31 spinal nerves. How many were there? What was the weird number? Yeah, there were 8 cranials. So 1 through 4 emerge in the cervical plexus. And then C5 through T1, thoracic number 1, they form the brachial plexus. And where's your brachial region? What does that refer to? Yeah, your arm. So this is the big giant bundle of nerves that's going to go out to your arm. It's going to go to your biceps brachii and your triceps brachii and your pronator teres and your coracobrachialis and all those muscles, all right? Then down between L1 and L4 we have the lumbar plexus, which is again a big giant group. Notice it says I have L1 to L4 in my text. It says L1 to L5. They kind of all run together here, so I don't care. I won't hit you with that. I'll never expect you to know that. And then notice here sacral plexus L4 to S4. I say the diagram says S1 to S5, whatever. They all kind of bundle together. That's the important thing. Now, why are the plexuses important? Well, one of the things you can do is you can identify nerves according to the plexus. So, for example, just to foreshadow, when you look down in the leg and you're trying to figure out what nerve you're looking at, one of the things you can do is follow the nerve back to the spinal cord and see which plexus it comes out of. So, for example, the femoral nerve emerges from the lumbar plexus, whereas the sciatic nerve emerges from the sacral plexus. Those are two nerves that people often get confused, and what I'm saying is you can avoid that confusion by following the nerve back to the plexus. Right? If it's emerging from the lumbar plexus, it must be the femoral nerve, big giant nerve. But the other big giant nerve will be coming out of the sacral plexus. That's got to be the sciatic. So plexuses, let's start looking at them one at a time. And here are the nerves that you're responsible for your lab. So coming out of the cervical plexus is the phrenic nerve. It innervates the diaphragm. The PHR of phrenic is the same PHR as diaphragm. So the phrenic nerve innervates the diaphragm. It emerges between C3 and C5. Notice how, again, look at the plexus. See how they're all bundled together? That's why on the previous slide, you know, sometimes the designations, you'll see them differ from one book to another, whether it says, you know, L4, L5, and so on. That's because they kind of all merge together there. But we say that damage to the spinal cord above this point causes respiratory failure. The little a rhyme that people use is C3 to C5 keeps the diaphragm alive. If you injure your spinal cord above C5, you may not be able to breathe. You've only got a short time to live before somebody's got to start supplying you with air, otherwise you're not going to make it. If you damage below C5, at least you can still breathe. Notice, by the way, you've seen people, paraplegics and quadriplegics. What's going on? Think about that. Where would the spinal cord be damaged if you could use your arms but not your legs? Whereas, where could the spinal cord be damaged that would prevent you from using either your arms or your legs? I'll talk about that more in a minute. But the phrenic nerve is one nerve that comes out of the cervical plexus. Another is the supraclavicular. Supra, again, means above. Clavicular, so where do you find the supraclavicular nerve? You find it above the clavicle, all right? It runs right underneath platysma, that big muscle, and it's a strictly sensory nerve. Remember, we said that most nerves are both sensory and motor. Well, here's one that's only sensory. So what it does is it innervates the skin in the neck, shoulder, and upper chest. So if someone is touching the skin of your neck, the only way you know that that's happening is the supraclavicular nerve is taking that sensory information to your brain. Notice how useful this is for diagnosing damage, like somebody in some sort of trauma, some sort of accident. If they can't feel their neck, you touch them on the neck, they can't feel it, indication that perhaps the supraclavicular nerve is damaged. The diagnosis is very complicated, lots of other things to sort out, lots of differentials, but in other words, that would be one possibility. If they can't feel you touch their neck, maybe the supraclavicular nerve has been damaged. So there you go, those are the only two nerves you have to know of that emerge from the cervical plexus. Go on, whoops, I talked over the break, can't do that. The brachial plexus, look at the big giant bundle of nerves here. These are going out to your arm, all right? These are the nerves that are going to innervate the muscles of your arm. The word innervate, by the way, means the nerve goes to the muscle. We say that the nerve innervates the muscle, or the muscle is innervated by the nerve. So the axillary nerve, where does that go? Remember, it's not auxiliary. I'll mark that wrong, and I won't even hesitate. Axillary is your armpit. So look there in the diagram, look in the far left, see the axillary nerve? It's going to deltoid and teres minor. See, remember deltoid, the big giant triangular muscle there on your shoulder? That's where the axillary nerve is going. So I want you, for every nerve, I want you to know innervations of the nerve. You only have to know one. So if I were to ask you on an exam, what is the innervation of the axillary nerve, you could say either the deltoid muscle or you could say teres minor. I'll count either one correct. So axillary is one nerve that comes out of the brachial plexus. Suprascapular, where is it going to go? Suprascapular, over the scapula, all right? And remember, what do we have on the back side of the scapula? We have the spine of the scapula. Remember, the space above the scapular spine was the supraspinous fossa, and the space below was the infraspinous fossa. We had the muscles supraspinatus and infraspinatus, and by golly, if you go over the back of the scapula, that's where you're going. So look how easy that is. I want you to know the innervation of the suprascapular nerve. You just have to know one, but how easy can it be? It goes to those two fossae right there on the posterior side of the scapula. Continuing with the brachial plexus, we have the musculocutaneous nerve. Notice musculocutaneous. So musculo for muscles, cutaneous is for skin. The root word cutaneous has to do with skin. This is a nerve that in the upper half of the arm, it's motor, it innervates muscles. In the lower half of the arm, it's strictly sensory, so it innervates the skin. So it's musculocutaneous. It innervates coracobrachialis, biceps brachii, and brachialis. Notice those are forearm flexors, all right? All three of those are forearm flexors. So that's pretty easiest. Musculocutaneous, pretty easiest. Musculocutaneous nerve, pretty easy. In the upper arm, what are the big muscles in your upper arm that flex? Well, those are the three, and there you go. That's the innervation of the musculocutaneous nerve. Radial nerve, it starts way up high and goes all the way down to the lower arm. On practicals, I will only mark the radial nerve in the lower arm. That should make it easier for you. If I mark a nerve in the upper arm, it's got to be either axillary or musculocutaneous. I will only mark radial and the other ones that we'll see in a moment in the lower arm. So radial nerve innervates the extensors mostly, all right? So of the wrist and of the fingers and of the thumb and so on. So all you have to know is one of those muscles. If I ask you for the innervation of the radial nerve, just tell me one of those. How easy. Just think extensors. Think radial extensors and you can guess and get it right. The median nerve, where's that going to be? Right down the middle, all right? Remember we saw that before in the muscles. Carpal tunnel syndrome is compression of the median nerve. So it goes to flexors. Flexor carpi radialis, flexor digitorum superficialis, pronator teres. So median nerve innervates flexors. And then finally the ulnar nerve innervates other flexors, flexor carpi ulnaris, flexor digitorum profundus. Notice ulnar innervates the muscle that has ulnar in its name. So pretty easy, all right? So there you go. That takes care of the remaining nerves that you have to know that emerge from the brachial plexus. Let's move on to the lumbar plexus. So the genitofemoral or genitofemoral, people say it lots of ways, I don't care, innervates the skin over the genitals and thighs, including scrotum and labia major. So this is a nerve for those really sensitive areas where you get that very special touch. That's going to be carried, those sensations carried back through the genitofemoral nerve. Notice genitofemoral goes to your genitals and your femur. And what we'll see is if you look at the nerve in the picture there, and this doesn't have a very good picture here, we'll see it on a diagram coming up later. It branches, and one branch goes to the genitals and the other branch goes to the femur. So in that way it's easy to spot the genitofemoral nerve. It's the branching nerve where one branch goes to the genitals, the other branch goes to the femur. Ilioinguinal, so where's your inguinal region? Remember, that's your crotch area, all right? So ilio is going to wrap around the iliac crest, and that's an easy way to spot the ilioinguinal nerve, all right? So wraps around the iliac crest and then goes down to your inguinal region. It innervates also skin over the genitals and thighs, including scrotum and labia major. Then the femoral or femoral nerve, this innervates those big quadriceps muscles, plus sartorius, pectineus, iliacus, and psoas major. So notice those are, we have a hip flexor there, and then we have extensors of the lower leg. So the femoral nerve comes, think of it as basically going down the front of your leg, because that's where you find the quads, okay? So those are three of the nerves you have to know emerging from the lumbar plexus. And there are a few more. The saphenous nerve. So the saphenous branches off of the femoral, and this is a strictly sensory nerve. Easy way for me to remember the saphenous is when you wear long pants like jeans, you know there's the inseam that runs right down the inner aspect of your leg. The saphenous nerve follows the inseam of your pant leg. So that's where it goes. It goes down the medial aspect of your entire leg. It's both on the upper and on the lower part of the leg. So saphenous nerve all the way down, strictly sensory. It innervates skin over the medial surface of the leg because that's where it is, all right? Then the obturator nerve, that's going to be easy. How do you spot the obturator nerve? It goes right through the obturator foramen. How easy can it get? It innervates, we remember what muscles are there, what muscles are on the medial aspect of the thigh. You got adductor magnus, adductor longus, gracilis, and pectineus. You got the adductors. So it's so easy. That nerve goes to the medial side of the leg. You wouldn't mix this up with the saphenous because the saphenous is strictly sensory. So all of those muscles on the medial aspect of your thigh, the ones that do the adduction, those are all innervated by the obturator nerve. Then continuing finally with the sacral plexus, we have the pudendal nerve. The pudendal nerve innervates muscles of the perineum. Perineum is that special little area of the skin in between the urethral and anal sphincters. Alright, so, and then pudendal nerve innervates the skin of the genitals, the penis, and the clitoris. So again, this is a very nerve responsible for some very sensitive feelings down there. And it's also responsible for erection of the penis and clitoris and ejaculation. So this is a sexual performance nerve. And in fact, there's an old medical school saying, says S2 to S4 keeps your willy off the floor. So again, erection of the penis is not possible without the function of the pudendal nerve. Right? Goes right down there, does motor innervation of those areas down there, those sensitive areas. The clitoris, by the way, becomes erect just like the penis does. Talk about that in Bio 202. Yeah, I'm sure you probably noticed. Pudenda, by the way, in Latin means shame. So this is easy to remember. The pudendal nerve goes to the things you're ashamed of. Isn't that wonderful that medicine is basically hindering your ability to appreciate your own body? That's terrible. The sciatic nerve, this is really important. We've talked about the sciatic nerve before. This is the largest nerve in your body. And in fact, it's really two separate nerves that are wrapped in the same wrapper. So it splits into the tibial and common fibular, or an older name, common perineal nerves. So it innervates the hamstrings, the flexors of the foot, and extensors of the toes. So remember, the hamstrings are posterior. So another way to keep femoral and sciatic straight is that femoral is going down the front side of the leg, sciatic is going down the back. Now, let me just point this out now, and I'll try to keep mentioning it as often as I can think. The tibial nerve goes right down the back of your tibia. It runs posterior to the tibia, all the way down, and then it splits into the plantar nerves, which we'll see in a moment. The common fibular nerve wraps around the knee, all right, and it becomes, there are actually two nerves, superficial and deep fibular. I don't make you know those, but that's one of the ways that you can spot the difference between the tibial and the common fibular nerve. And by the way, you have to say common fibular. If you say just fibular, I'll mark it wrong. Common, we'll see this a lot in Bio 202, means that things are going to branch. You have a lot of blood vessels where you have the common, and then you have the right and the left, or the anterior and the posterior, and so on. So common fibular, because it's going to split into the deep and superficial fibulars. But once again, the tibial nerve, easy to spot because it runs down the posterior side of the tibia all the way down to your heel, whereas the common fibular, it runs down your thigh, but then it wraps around the knee, and then it goes down your fibula. And then more from the sacral plexus, here the tibia, splitting into the lateral and medial plantar nerves. And those are easy to spot because they go on the plantar surface of your body. One of them is medial, the other one's lateral. That's pretty darn easy. Innervates biceps femoris, semimembranosus, semitendinosus, gastrocnemius, soleus, flexor digitorum longus. So it innervates some of the hamstrings, but then goes all the way down the back of your thigh. Remember, I said the tibia is on the posterior, not the thigh, the lower leg. I said the tibia is posterior. Oh, jeez. The tibial nerve is posterior to the tibia, and that makes sense because that's where your gastrocs and your soleus are. They're back there. That's tibial nerve innervation. Common fibular wraps around the knee, goes biceps femoris again, tibialis anterior, fibularis longus, fibularis brevis, extensor digitorum longus. Just know one of those, okay, and you'll be fine. And finishing up the sacral plexus here, the sural nerve. Remember, where's your sural region? Yeah, your calf. So one thing, sometimes people mix up the tibial nerve and the sural nerve. Don't do that. It's easy. The tibial nerve runs deep. A good thing to learn now, it's true of the blood vessels as well. Generally, if something is named for a bone or for a region, well, for a bone especially, it runs deep. In this case, the sural nerve is more superficial. So the tibial nerve runs right next to the bone. The sacral nerve is way out in your calf. So formed from branches of tibial and common fibular nerves. It's strictly sensory. We've seen a few strictly sensories, haven't we? What ones have you seen so far? Saphenous, remember? All right. So, and there was another one. Think of that. Remind yourself. This is going to innervate skin of the lower leg and foot. All right. And then the medial and lateral plantar nerves innervate muscles of the foot, and that's all there is to it. All right. So there you go. Those are all the nerves that you have to know. Those are the ones that you'll have to know on your lab practical exams. So knowing which plexus they come out of and knowing what muscles they go to helps you spot the nerve. It'll help you figure out what you're looking at.